Hello, dear friends. This is Sofya Dorinskaya with you, President of the International Bureau for Human Rights in Mental Health and head of the Sofya Dorinskaya Center for Medical Information. I get asked a lot, how is it that your test works and you don't require blood tests for vitamins and minerals? I want to tell you that the presence of a particular vitamin or mineral in the bloodstream is not a guarantee that the cells of the body will actually absorb these substances. For example, there are two different conditions. One is called hypomagnesemia, which means a reduced level of magnesium in the blood, and the other is magnesium deficiency. In some publications, these terms are used as synonyms, meaning they refer to the same condition in different ways, but in reality, they are two different conditions. So hypomagnesemia is when, according to a blood test, a person has low magnesium in their blood, right? But magnesium deficiency is when the body's cells are not getting enough magnesium. And the interesting thing is that a person may not have hypomagnesemia. That is, their blood test for magnesium may be completely normal, but at the same time they may have a magnesium deficiency, meaning the body's cells are not absorbing magnesium. And our test is meticulously and specifically designed for identifying and detecting the subtle signs of nutritional deficiencies and imbalances in vitamins, minerals, and essential trace elements. I would like to ask you a question. If a person, for instance, currently has a perfectly normal magnesium level in their blood test, but at the very same time they are clearly showing all the classic symptoms of a magnesium deficiency, what do you personally think would be a much more reliable and accurate source for determining the actual underlying cause of their medical condition? After all, we must always remember that all of these instrumental diagnostic methods are, in every case, always just auxiliary methods for us to use. To put it bluntly, it's just another crutch for the doctor, something to help them draw the right conclusions from the observations they have of the patient, whether from questioning, gathering additional medical history, and so on. In other words, tests are always an accompanying tool. But if the doctor observes signs of a deficiency and yet there is no deficiency of that substance in the blood, for example, then one should always lean toward what the patient themselves is demonstrating, what the person the doctor is helping is showing. Because, well, our client or the doctor's patient during the appointment really doesn't care what the test results say. A person measures their health by how they feel, and those sensations are what need to be clarified with the person. And to be perfectly honest with you, it is precisely these visible physical manifestations of nutritional deficiencies that serve as our primary entry point. That is to say, well, it is sort of like that specific tool or that particular moment. It is a significant discovery, if you will, that we have made regarding exactly how to identify and categorize these complex nutrient deficiencies in plants. This method allows us to see what is happening beneath the surface by observing the outward signs. Let me tell you another story that happened to us. The client has already been discharged. A mother of a 6-year-old boy came to us. For 3 years, this boy had been on antipsychotics. That is, this child received so-called courses of antipsychotic treatment 3 times a year. For what reason? Because of a tic. And when we gathered all the information about which antipsychotics the neurologist had prescribed him, it was immediately obvious that this neurologist had seen toxic effects in the child in the form of tardive dyskinesia, that is, this delayed onset dyskinesia. And it was clear that the neurologist already understood what she had done, and she was changing these antipsychotics for the child. But of course the condition did not go away. The mother came to us in tears, already in a completely distressed state, and we took this child for testing and gradually eliminated all his nutrient deficiencies. Naturally, the mother was told that if the condition had already become tardive dyskinesia, then according to all the established guidelines, this is considered an irreversible condition. Our only hope was that the child was still 6 years old, the body was growing, and if we eliminated the deficiencies and created the most comfortable conditions possible for the body to develop, then in general the body, well, physically, it should still grow about twice as much, and maybe the body would rebuild its neural connections. That is, well, this was simply our hope, so to speak. And I have to say that as we addressed the deficiencies, the child gradually began to show fewer of those severe tics and symptoms of neuroleptic poisoning. And you could say tardive dyskinesia symptoms. They kept decreasing, and only some residual effects remained. We told the mother that she just needed to wait and keep giving vitamins. According to the test, the deficiencies have been corrected. We outlined a tapering plan for the child, and literally within days, about a week later, the mother wrote to say that they had started the tapering protocol. As soon as we reduced the dosage according to this protocol, the tics, twitches, and contortions reappeared and intensified. The child would twist their own hands. It was truly a severe condition. That's it. And I gathered an additional, more detailed medical history for this case, because it was clear that for some reason the body was unable to absorb minerals from food and from the usual doses of vitamins. The body just wasn't absorbing minerals for some reason. I collected an additional, that is, an expanded medical history. It turned out that before the onset of these tics, up to the age of 3, the child was developing completely normally. There was no weight deficiency, but now there is an obvious weight deficiency. That's it. But at the age of 3 or closer to 3 in the summer, he was taken to the country house, and the child drank water from a well and then suffered a severe poisoning with fever, hospitalization, large doses of antibiotics, and of course treatment. And I asked the mother whether the intestinal flora was restored after the antibiotic treatment. The mother said no. The child was referred to a gastroenterologist at their place of residence, and I had 2 questions that they needed to answer for me. The first was, is there any undetected helminthic worm infestation? That is, they needed to do tests and undergo an in-person examination by a doctor. And my second question was that they needed to do tests for dysbiosis. The examination ruled out helminths. In other words, there were no worms. But the test for dysbiosis showed that yes, it was present. According to the gastroenterologist's prescription, the dysbiosis was treated, and as soon as the child started receiving the necessary bacteria, our vitamin regimen began to work very effectively right away. And it became obvious that these tics and the residual effects from the child's use of neuroleptics, these severe joint twisting movements, immediately began to subside very quickly. The child took the bacteria prescribed by the gastroenterologist for 10 days, and very, very quickly the body began to recover. That's it. Again, a regimen was prescribed to gradually reduce with daily or every 3 days regular doses of vitamins. And now, of course, I keep in touch with the mother. Now the boy has started to gain weight. He runs around with his peers, he plays football. And in her latest letter, she wrote that there are no signs of tics, no insomnia, nothing at all. In other words, he is now a completely healthy child. That's how our test works. That's how we identify deficiencies based on their manifestations. And most interestingly, we can suggest a particular pathology based on how deficiencies are corrected, or how a person feels once the deficiencies have been addressed and they switch to regular vitamin doses. What happens to them then, right? And in this way, we can guide and determine what is the root cause of a person's not so good condition. That is exactly why our test is so effective, because we carefully examine the physical manifestations of deficiencies. And we understand the fundamental fact that vitamins, minerals, and trace elements are all essential components of human nutrition. The human body, like any body created by nature, does everything it can to keep living. It does everything it can to survive. If something goes wrong, there is a reason for that malfunction. And if you go to doctors, you are completely healthy, but you still feel unwell. So what does it mean when a person feels unwell? They have a manifestation or manifestations of some kind of suffering. And the very first suffering, which is the precursor to all diseases, is a deficiency of vitamins, minerals, and trace elements. That is exactly where the cause of your condition lies. And if these deficiencies are not addressed, they will develop into various pathologies. This is exactly how our test works. This is exactly how we work with our clients. Those who are doing well eliminate their deficiencies and feel great. Well, for them, goodbye and all the best. For those who have certain barriers, we start to identify and clarify them, and we direct people not just to undergo some examination, but to a specific examination with specific doctors in person at their place of residence, and they must bring us answers to our specific questions. And then, listening to what the doctors have found during the examination, of course people undergo treatment, and we see that the problem is resolved once and for all. I hope I have answered the question of how the nutrient deficiency test at the Sofya Dorinskaya Medical Information Center works. We will be glad to welcome those who decide to take this test and restore their health. This was Sofya Dorinskaya. All the best. Goodbye.